founder of the Auth Method, and I'm here at Oakworks in New Freedom, Pennsylvania. I'm going to demonstrate some forearm massage strokes in side-lying position, utilizing the Oakworks side-lying position system. We're going to go over some forearm massage techniques for the hip area in general. Side-lying position is such an advantage, namely because all the muscles that run along the sides of the body become more available in side-lying position. I'm going to start out by working the TFL, which is a classic example of a muscle that runs along the side of the body that's difficult to get to in supine or prone position, and when tight can cause your clients a fair bit of pain. So I'm going to use the top of my forearm versus the middle or lower forearm because I have the most leverage in my upper forearm. And I'm going to take my upper forearm just below my model Josh, his iliac crest, and I'm going to glide down the TFL till I hit the greater trochanter. And this is a short stroke. This is just a couple of inches. And when I reach the greater trochanter, I'm going to lift up and begin the stroke again. So I'm sitting on the table and I've got my shoulder over the area I'm working on, and I'm just leaning body weight into this. There's no need for me to push or overexert as I glide down this muscle. So this time I'm going to angle my forearm so that I slide past the greater trochanter and further down the TFL. And again, this is one of those tricky little spots that can get tight and create quite a bit of pain. Do this stroke again, coupled with some movement by Josh. So Josh, go ahead and lift your left knee about an inch up off the cushion. Good. And that just activates the TFL, and then release it and intensifies the massage stroke that I'm doing. So let's do that again. Go ahead and lift up slowly. Good. And back down. And lift up. Perfect. And back down. Side-lying position system is also easy because your back is nice and straight while you're working. Now we're going to work the front of Josh's hip along the psoas. If you are inexperienced with working the psoas, I recommend taking one of my workshops before trying this one on your clients. So I'm just going to pull his hip back a little bit so that I have easier access to his psoas. And again, I'm going to take my upper forearm just inside the pelvic bowl. And I find this is the easiest way to get into the psoas, much easier than working the psoas in supine position, because gravity moves the belly out of the way and creates space for you to work. And it's just more comfortable for your client. Side-lying position is a bit like a fetal position, and it feels less invasive to get work done on your psoas in this position. So I'm starting up around the ASIS, and I'm working towards the pubic bone. I'm never going to reach the pubic bone, but that's the direction I'm going in. And there's just a perfect little space here for my forearm. And again, I'm just dropping body weight onto the tissue, and I'm just working that first layer of tight tissue first. So I'm not pushing through tight layers of tissue because that would be too painful. I'm just going to that first layer of tight tissue, and as it releases, I'm sinking into the next layer of tight tissue. And this is a way to do deep work that's comfortable for you and your client. And if I wanted to work even deeper, I could just pull his hip back further or push it down further to get a little bit more length through the psoas. Okay, now we're going to scoot on down to the IT band. That's okay, just relax. So I'm just going to take my forearm, I'm sitting on the table just behind Josh's knees, and I'm just going to take my forearm that's closest to Josh. I'm going to rest my passive hand on his hip and just glide down the IT band with the top of the forearm. Inclines can be quite tight here, so proceed slowly. And again, I'm just leaning towards the stroke, and that's all the pressure I need to get nice and deep. And Josh, go ahead and lift your knee up towards the ceiling and back down. And again, I'm just getting him to activate through his IT. And that's just going to intensify the work that I'm doing. And lift up. Good. And release. Hey, he's not that tight here, but if I needed to, I could wait and have him breathe and slow down and wait for a release. But he feels pretty good through here. Okay, so this is a segment of my hip and leg routine from my DVD, A Guide to Sideline Position, which can be found on my website at authmethod.com. Thank you.